show, we will meet a boy, Jaden, with a peculiar condition that his family can't even begin to talk about. Can you imagine having a baby who doesn't have genitalia? Well, we'll be discussing fatty liver with Dr. Amwakudua and the myth that is of great concern to men and some women. This show is brought to you by Vodafone. Further together.
Now you can be part of the extraordinary world of endless possibilities on Vodafone. With the best value and amazing data offers and services available in Ghana, your dreams are achievable. Get more for less with Vodafone data. Vodafone, further together.
My partners in crime are with me right now, looking all dashing. I really like the combination. Now, thank you, dear gentle. Oh, I like the color.
Thank you very much.
I like this color. I do.
Thank you very much. Thank you. Thank you very much.
And Abba happens to be wearing my favorite lipstick color.
Oh, what color is it on my lips again?
I think it's burgundy or something like that.
All right.
Anyway, enough of fashion. Let's see what we have for our meet today. Poor daddy.
He looked traumatized.
He did. He did. No wonder the midwives tell me that, well, they don't mind the daddies helping the mother's labor. When it's time to push and see what really comes out, no, rather not. Because some of them do collapse. Because when they see the baby coming out, they think,
That is not why they are
collapsing.
They are collapsing because when they see the amount of pain their wives are
I doubt it.
And what I'm telling you, what I
tell us.
The amount of pain that the wife
They're
is
thinking,
going
I
through.
didn't say.
You see,
we are thinking the same thing.
I think that men and women's mind work different. I'm telling you what you will think when you see your wife going through all of that.
Mm-hmm.
To see that 10 centimeter cranium coming out, crowning, everything stretches round it.
Stretches.
It stretches round it, and you can see. I mean, it's not easy to just see your wife there and be saying, "Oh wow, a baby is coming." It's a lot to take in. I mean, kudos to all the men who have been bold enough to go into the labor room and assist with their wife, providing emotional support and.
Oh man, when push has come to real show, literally. You are standing there giving moral support.
Moral support.
Moral
support. You don't know what moral support can do.
The party was so nice. I wish you could repeat it.
This moral support.
I did not say you. But does that happen though?
I'm very sad that you think that's all men think about. See,
convince us.
No.
Is that myth though? Some men may be thinking that way. So please, being a man, please do tell them whether it's true or not, because we know the truth.
So the truth is, I mean, that one is a corner where only you and your husband may be seeing. But look at the woman in general. Pre-pregnancy, post-pregnancy, she returns to almost splendid before pregnancy. I mean, if she's eating well and everything. So, yes, it doesn't permanently expand. There will be some changes, like the whole body going through some changes. My wife's having to do some pot belly developing now. It's changes. It's life changes.
Prosperous.
So you see, my point is usually we focus so much on the woman's changes.
Yes.
But I mean, I believe I'm changing as well. From when she saw me, I was a very sporting guy.
The
playing
6-pack
tennis.
and all that.
6 packs, not me, but you know, I was very sporty.
You're still 1 pack.
Oh, 1 pack, but I was sporty.
Yeah, okay,
This
yeah.
year and I did.
This is our prosper.
It's not true
Okay.
that during the vagina stretches indefinitely. It's not true.
Okay. Abba.
It doesn't. It doesn't. Thankfully.
Yeah.
If it did, I mean,
That would be strange.
God created the vagina for that particular purpose as well. To be able to accommodate a baby coming out, but also to be able to go back to its near normal size to perform the function that it was performing before the baby.
The word is near normal.
Yes, near normal.
Almost.
As near to normal as
Basically, no. Or patches say, "Enya dia or you remember say a virgin be into forgetting."
it's a virgin, don't you virgin? No, on your virgin, no do the labor water.
Exactly.
Yeah, you feel
It's, yeah, so don't expect it to be
Thank
like
you.
that.
Yes.
A whole human being has come out.
Yes.
But I don't think that there is some change. But ultimately, I think that because you see, some men are very apprehensive of that. You know, the fact
Yes.
that no wife on you the same again. And
I
all
know
of
a
that.
man because of that. He insisted that the wife has cesareans for
But
both
you know,
births.
to compare cesarean to vaginal
No,
delivery,
seriously, he did.
hey,
I think that this man may have had some misconceptions because I don't think that it will be that noticeable if nothing traumatic happens during the delivery. Okay, so
Traumatic
sometime- meaning that maybe the baby is too big or the delivery was too quick and the mother had some tears and all other kinds of complications, then that may cause some slowness in the return to normal. But usually because the vagina is an elastic, predominantly elastic tissue, it stretches and comes back to near normal. But especially when after delivery you put in the effort to exercise and tone those muscles and strengthen what they call the pelvic floor. So all those exercises called the Kegels exercises help to return
I have a question.
that's
When you finish, help
that
to return.
whole anatomy to near normal, to the point that you should still be able to
Enjoy yourself.
yes.
Okay, let me ask a quick one. So please, Sister, can you please, famous your patient, explain Kegels exercises to her?
So it basically means that or the etchim kaka.
Etchim then.
No, etchim kaka. Okay. So typically you do it when you go to the loo.
Yes.
Good.
And that's a nice opportunity to hold, because when the wee-wee is coming, you should try and hold the wee-wee from coming for a couple of seconds and then release. That will cause the muscles of the pelvic floor, to contract and then tighten up so that you are less likely to have this.
Once you're able to know how to hold the urine, that's a good starting point. Even as you're sitting here now, if you've learned how to hold the urine, you can be holding the urine inside of you, just like that. And it strengthens the pelvic floor and it really helps. You see, she said that the vagina is designed for that. If you look at the vagina, it's sewn in some folds. So even before delivery, God has made ready to expand. So once it's not like it's stretching and has to come back. It's just sort of opening up, of course with some stretching, and then sort of just closes in again on itself. So yes, there will be some changes, but the vagina will return to a fairly normal state. And then, if you're doing a good job, the shaft also, with use hypertrophy.
Goodness.
You see, there's a small inside joke.
Have a book, no.
So I use on the exercise. I don't know exercise.
Shaft
I
hypertrophy.
don't know exercising. Exercise, man.
Disclaimer.
So,
I have no idea what he's
Mr.
talking about.
Mr. There, hopefully, tell you, if you have been doing the work well over the years since the time you met your partner, and you've been using the machine, then want to hopefully don't be afraid that your wife's own will
Get bigger
get
than
bigger.
yours. Yours
let's pray that you also, you know,
You wish
to and then
Let me before soap how.
but there is some
Research
some evidence to show that the more you use the organ, the more it gets bigger. I could ask some personal questions, but I'd rather not.
But generally, I think
We
that
shan't answer.
women who use all sorts of concoctions because they are afraid they'll lose their men after childbirth, just in the aim of tightening or getting it back to what they think normal is, and sometimes even abnormal, I think it could be, should be careful about
Yes.
it. If truly something really traumatic did happen, I'm sure that your doctor or midwife would inform you. And I've heard that now there are medical procedures by very, very specialized people for such cases. Like, it's very rare. I've spoken to one doctor like that before. I don't know if he doesn't mind mention his name, but maybe not. But that's something that's part of his work that he does from time to time. But he says it's very, very, very rare for that to happen. But a few women can have such a tear that they need a repair. And
Yes.
in that repair doesn't mean that, you know,
No, so
they are making them become like virgins. But it can happen.
it gets
Such
close
a
to
tear can
normal.
happen.
You know,
yeah.
when the tear happens, if it's not sewn well,
Yeah.
sometimes there's a dysmorphism. The perineal area doesn't look right. You know, aside the feel, it doesn't look right. So sometimes you may have to undo it,
Do it
literally
and redo,
open it and
exactly.
then redo
I'm
it.
sure that's what he was
And
trying to
about
explain to me.
the women who try to tighten up, not just delivery, after delivery, some of them even before they deliver, they have all these things to sort of tighten the
But
area.
are they doing open
No.
shut them?
No.
Open shut?
Like
all the time.
The idea for what I've heard is that it sort of makes them tight and gives the perception to the
Man.
partner or the man that they haven't been exposed.
Oh,
And it
okay.
actually has very bizarre complications. When such, because some of them do this by fibrosis, so
Yes,
they
I was
form
going
a
to
form
say,
of
yeah.
scar tissue.
Tissues, yes.
So if you're in the whole habit of doing that now, for instance, if you get pregnant and you can't relax and open like the vagina is supposed to
You
do,
can't give birth through that.
then you tear through it.
Exactly.
Ta- ta- ta-
And
ta-
that's-
Fibrous tissue cannot expand
expand.
and relax.
So
It just
that's-
tears like a scar.
Yeah.
That is
Oh,
disastrous.
I don't want to imagine that. So we'll meet a little boy or girl or a family. You see, I can't even describe it because that's what it is. It's something that it's not very common to see, and the family, they don't even know how to talk about it, let alone me.
Many the first thing fita krade Jaden be my brabo me no ninsa no no maka do ya mankwati ninsa so any part too but story na ye mankwati papa no wante no ama ye phone no and unfortunately afano so be onya issue the count e wonu mo na na ma me from bisam the first year wa bede na me say okay no no ntima ma na answer ye no so abe na ntima nkasa nam so afra no ho ye na ebe na mo wo no me hu so ebe nyina na besia no so na nsa me weni nimpa wo na minim be nyina na minim besia
nsa mo kwahwa no no na enutin
ni be nyini no na hwa wo ho hwa no so ekwope no wo na oba ne na ebon na oda nka so nchi fem wo be nyin okotim no eho no oni bi nti oba no na ya naturally oba wiase no na hole kaka wo ho a so nchi na toilet ni fem nti ya hwa na SS fo no baka nti medawa de che na waka na menko kolebu wa toilet am de menko kolebu nti edu kolebu no na doctor se na ka de baby a toilet na so nchi na fa no nye nti wana oda we na operation
na ne mfe no na wo te wo ne fe ha nta akọ toilet a akọ wo ne mfe abira bokọ toilet no abla no lusu
nti ne mu na waka na oda osonso onyi ne kaka besa so an operation for toilet most of them obenya hole on it
Nti you should the man not see na mesa. Na me da the doctor so catch a doctor there. Abafo no ko toilet a. You sunu o ya ate nti okona what you for the man ho bottle. One fan for the man ho ntam. No ka na sada me da. Obagin the miskets ne wo tum wesu ne fa adam. Na wa direct aminuti.
But unfortunately, 1 year no. Other toilet no for one for so come back to naturally ne a born or the bed for Johnson a toilet. Toilet is also back. Until one other rush was also no go back. Or quite another third operation. Most of by a sunshine persons to a separate bill. No was also go in infinite bill. Until at the moment, no why no to no a born. Why a bonnet but toilet in film. Until yes also come back for them funeral. Until no shatter or that day BB added to BB at better than film. Most of by our toilet. I bet check I hand them up. Not on every day be an old say.
E be ko tani be se na toilet na aba. Na ko butu mu ana ma da achi.
Until seconds be I odidi be I order check ma. Instead of door ko toilet on it to me. Yeah sure. Nemfi. Na ye nak pinefuo. Na ya the for fresh the man na ye. Ya kwa another fourth operation. Na what pen na ya de. Because on am the third one 1 year nti na opedon wo say square. 1 year na 1 year.
Ni ye hu baby akora ya jiro ko. What to sika samso.
The people be say there. I be the first year ko fedra nti na ye funu afọ no when your problem so no. It's okay. Jaden for don't go school. No go school abeda na obet no wase. First, nanka so baby sa no there. Jaden me yan because na lampo na mo tum ko toilet no bi sa na toilet class and me ni answer to no question. Me fiam there. And I say me sure maybe someone there. It's Jaden obey pennies and no you the man obey. And I'm more pass the man.
Oh, she said, Munwaji.
Madam Vodafone fast there. Mama the batu and name so. Who did the mob on a situation or Bob one.
But if Madam one as a pea.
Yamin sure, now coupons will be on Cordona. On more ya, but there, oh, more former now one now. Save your obey ya, when the more abominable. On swing be pepper fainting.
So, the idea of Jaden's full recovery would mean multiple surgeries, right?
First and
Because
foremost for me.
no genitalia, where the urinary tract, there's no, I can't see anything for urinary tract. We didn't hear anything about fecal matter. So, all that has to be reconstructed or what?
So there is a urinary tract.
Yeah, like
There is
tiny hole.
a place of fecal matter, but they haven't formed
Outlet.
well.
Okay.
On there, in the growing embryo, they all form from a common bud, common either hole, but it's supposed to have a septum either or the tube ninya, the tube num odo tum close no su, na enyim ko enyim, na tube.
Oh.
So good. It's a tube that connects in the beginning.
Okay.
No way, no separate stomachs. It's band side and from Swanchen side, But when this closing one happen then you see that it's all now one and together. Now this has bizarre complications because on there, if you start like toilets in it, na say start Swanchen it, Swanchen is organisms know what toilet side, and if they are not partitioned or separated from the urine side, they're gonna go up. It's gonna have constant infections here and there. I mean, before we even go to the psychology of how the family is taking it, I think that having an understanding of how these things happen reduces the propensity that you be naming as Bosumba and things like that.
But like I asked, will it require multiple surgeries?
It probably will. And it will require a staged, well-planned procedure.
Okay.
Because it depends also on the extent of the anomaly, which organ systems are involved, at what level are they involved, are other organs involved. It will require a multidisciplinary team approach to do this in a systematic, staged manner.
Yeah.
I'm thinking also the social bit of it, where so you have a baby, oh, it's a boy, it's a girl. At birth, they present your baby to you. You are not sure whether it's a boy or it's a girl. So what would be the recommendation? Is it that, I'm just throwing this for us to discuss, what would be better to say that as a parent, I think my child is a girl and that's how I'm going to bring the child up. I think that it is very tricky because you might say this baby looks like a girl, but then we'll find out later on that it's actually a boy genetically. And then now reconditioning the child's mind, the parents' mind, the nosy relatives' minds about what this child really is.
I forgot about the community.
The community, exactly. Everybody involved will be now wondering why this person looks like a girl, dresses like a girl, but
it's a boy.
Yes.
I mean, so to say that, I mean, it's a difficult place for any parent to be, but the mother can say, it starts off then at puberty,
that's where it really shows.
It's now developing breast, that it becomes a little difficult to do. So there are testings. There are ways to test and determine genetic, to test
early on,
so that you know which way to lean towards, so that you could better the child's chances of living a fairly normal.
Well, once again, I'm grateful to Vodafone Healthline because I'm sure that with their help, Jaden's parents, or actually mother and grandmother, would be able to find out what gender he really is and get the surgeries he needs, or he or she needs, from what Abba is saying now. I'm not even sure how to address it. It's confusing, and we do not want to label, we do not want to accuse, and it's not right. We just pray for baby Jaden because we're sure that he'll be just fine. We'll be right back.
So that mom can be able to open the door. This is it.
Place it on the door.
Here's my little brother doing something special. He's setting the camera up with another bright idea.
Let's just open the door.
Yay!
Mom, I got this.
Afedie, usu betumi anya kwanya sronko a ye nije ye power Vodafone so. Ye di data bundles a eni seso Ghana ha brel. Ye ma oda ye so, ye ni daso nyina bem. Enti beka ye ho, nya data mo ani je power bebre.
Vodafone, further together.
So the question is, if there's fat in the liver, and so what? After all, there's fat in our bodies. It's here crown says radia corners on a patch. It is radia or me liver one and bread one eye. Sir, asem or one as asem. To understand this, we have Dr. Amwakudia from UGMC, that's University of Ghana Medical Center, to explain this to us, because I have a feeling it can be deadly. Doc, welcome to Vodafone Healthline.
Thank you.
Doc, one more month. Yeah, who as in the liver, the functions, why is it important, and whether actually having fat in it is dangerous or not. If you can briefly tell us about that.
And it's you can't brabo na liver the aye say a boama aduane a yedie no etimi digest no
Okay.
ana de ya body ni hia no at that particular time no body no na store
Okay.
said de be ya se unipadua ni hia na se unya ni di ya liver no e de be ba emoja num said de be ya body no betimi aye adwuma said de esitie ana se wudidi a won se didi aduane aye di ni nyina se ekoya yam na se ye digest ya na se moja no twetwe enuanu nuro nu ahia na ni nyina esa kofa liver no bio ansa na abaye body no enti eboa ema ayi enioma fi a aduane no aye di ni kura ewom no liver no boa ema no eyi film ana liver no so produce niama bebre ema your body no eye adwuma yi wo hwe proteins ye wo ye nipadua mu bebre a eye liver no na produce proteins no ebi ni clotting factors onse nipa wo ho na se bibi twawa eduru ba bi abon se wumia ho na asili
Yes.
cloto na asili ba bi a ho twaye no saa eniema ni nyina ye liver na e produce enti se liver na produce a anaso wo liver ya de na sentimi produce saa clotting factors na bibi twawo se ya obebi di saa na tie ana the last important am person make liver no boa ema eyi ediama fin bebre free ye nipadua no
okay
onso bi wo ha wo so wanya jaundice unya liver ya de a unya jaundice jaundice no eye eniama a ewo se etimi free wi nipadua no eye liver no produce na eyi afrim nti se wi liver no nya adwuma yi a obo se da adawani so because liver no entimi enyim free wi nipadua no ana yesa so a omanum aye yellow yesa so a wudi aduane aslade wo mu a because ade na ye yellow no ba no ayekọ yansunu mu no na babua na atwetwe sade no afre aduane ayedim
okay
enti se ba no ntimi nnuru wo nsunu no mu a omo tedi sade aduane no bo so mo toilet aslade nko na eba because enipadua no ntimi
entwenko moja ni muntina simbasa
sinibasa
ish baby bio benyan
obende say ade na enyan dada enti
no correct enti se srade ba ye liver no ho a we true of us dangerous and then dangerous
srade bebre ba ho a dangerous
bebre so the word is bebre
liver no srade
wom dada
ana liver na nkasa no aso no na menka se eye once your free will be cholesterol is the liver that produce that cholesterol okay so we will eat fat and the fat will get into the liver and the liver will turn it
into things we need
things that we need
okay
but a bedru baby no bon say liver no changing into cholesterol na eye say timi free liver no na ba ye nipadua no ana emoja no na emoja no de ko ye nipadua no ba bia ehia no wo excess amount of fat in the liver no eye wo mo a fat no liver no produce but intimi free blabo no ana say body no ma liver no pressure or the srade bebre ma liver no enti liver no change no intimi mfa ni nyina ma emoja no na agina blabo no say agina mu saa no a eye dangerous ma
enti say dose a dangerous then na deba then na be ma srade na kota liver ni musa
ya woni ma be enan a ma na deba enti se ka se srade bebre wo moja no liver no ma e kire se the amount of fat in the liver is more than 5% of the liver weight the weight of the liver ade a edi kan ya ma no pap edeba pa ye alcohol wo no mo nsa bebre no emu be 90% omo fatty liver enti e no alcoholic fatty liver disease the tosum you no ye say one say ye wo yade bi e no metabolic syndrome that metabolic syndrome omo diabetes omo eso bebre no ye overweight and obesity and now omo cholesterol bebre wo omo mojanum say omo dyslipidemia and high cholesterol and omo hypertension no sa eniema 9 way and de your friend non alcoholic fatty liver disease because no nya alcohol na deba so Nti saa nneɛma wei ɛna ɛno so de non-alcoholic fatty liver disease neba. Ɛna ɛsa wɔ yadeɛ bi wɔ hɔ nom a ɛno affect liver ne dada.
Okay.
Bi te sɛ hepatitis B, hepatitis C. Ɛna autoimmune hepatitis, yadeɛ ahodoɔ bi a affect liver ne dada. Ɛno so tumi ma sradeɛ bebree ɛdan egyina ayi. Ɛna afei de aka no nso bi wɔ pɛ so lose weight within a short time.
Abapa o.
Also keto diet. No lose within a short time and to me my fat gina
why fefe na ne brebo
na srade nko a na gina mu enti saa nneema ye kase fatty liver saa nneema enan we na ema no edeba
doc o ka non alcoholic no ma dua alcohol pa ipacho I mean how nko kakra
say non alcoholic no no na your problem say
waka se me
once first no hepatitis B ni hepatitis C no no ya kasa chronic liver disease ya no no yade a yeta bodin pa
any B na na yakoje vaccine
no vaccine say no non alcoholic no once diabetes doso e wo wiase
true
and nipa bebre so yakase so ho na aduane a yedie no I say fast food and sugar and coke and pie you were adwuma mu a
soft drinks no dos
ya say pressure anti ntimi nko break nko didi papa na ne to ne anom ne
asemo na yetifaako ne ya oda
ya nya exercise because they say nipa bebre nya scam de atoka nti woko ha ne hakura
no atuka
oba adwuma mu a de bia ya 3-story building 4-story building lift wo ho and there be over lift enti yenya exercise yeah inactive enti because of a niema we nti ama non alcoholic fatty liver no adosu bebre ewo ewiase ayewo say ya Ghana ka ho
nti obi wo non alcoholic fatty liver na signs ben and symptoms ben obenya no hu say bia we dey say me dwen say me ya nya we me nkona me nko hu liver specialist na obi sa no hwe ma me
nse bia say we yade a ebekun na ma nsunsan so bia anu ne afra no silent killers no
so na aka ase no ko metuo yare bekun no
yade ebekun dabi ama ti nyo ya ma awande no
normal
ha yesi nipa we wan nyale obi bia anya no
nothing
what a shock nanso na yade no na ewo ho no enti fatty liver no say anu say nipa bebre wo mu hwehwe but the time I hunu so obi wo fatty liver no say on say nipa nansen no so nipa ni ba wo mo apom din ho enti ma wo mo ko hospital say yearly check up and every 6 months bi wo mo ye check up so wo mo ye check up na ne hu say da bi wo mo liver function no problem ho ya ba hwehwe mu no na ye fat na de aba enipa kakra bi na beba o beka say wo mo right side of the abdomen no they have pain there okay or maybe the liver because of the excess amount of fat in the liver has become bigger than it's supposed to be so when you touch it on the right side the upper part you can feel that the liver is there okay so sometimes pain the liver enlarges and some of them too they have fatigue or juma kakra bi no abre eno no ye ensunsan so ye be kire yan say bia wo fatty liver most of the time no unhu hwe ida so on beba no na fat no awo ho no na asebrebo no na aduru ba bia say afra no cirrhosis
okay
eduru cirrhosis wa chese wo liver failure no eno no said the kwan ya asebrebo ni si ye adwuma no brebo no entime nya adwuma sa
brebo e wampe ntunya cirrhosis na liver failure na den na moye mo treatment bi amode man kofo ya na evans wo mom ye lucky na e ka hello
ayi seba non alcoholic fatty liver na onse no yenim de ma na deba enti so wo bi na se ehunu de ma na deba ya se bia wo mu ayedu bebre ana obesity a ye kan ho asemu wo so tebe by 7.5 or 10% of your baseline weight.
You are tight, weight mupe. Why okay?
Why are there? It's me bua amba blobo no. E da se be gina baby gina enko nanim.
Me mfanya mask kakra. Je so obi wo e bia obi weight say obi wa weight am bo na nchese sa weight ni nchese omu edu obi wa kokrowa pan ba kokofhwe ni weight for so 100 kg ne so to se kra ba to say 90 kra
nchese
okay.
Yes, obenya massive improvement
wow.
So fatty liver disease obenya massive improvement.
So every weight loss be an big kakra
be
accommodate so into anya ni gidi no so cause what catch us anya careful no
there be kakra every day be out to me lose be 1 kg
every day
every week be out lose 1 kg
1 kg every week
man said you buy so no betting kakra but also 10 man also send fatty liver
yaka say ma also ntinche say ko ni gidi
so na tie
doc ade ba kum say no betwa ma adwem mo we shina to me the
fatty liver dey affect body no ba bia o enti say wo fatty liver na say wonum cigarette ya o health no ma no nsisusu ye so ebetimi awersen no in terms of progression and I want say one say more fatty liver enye liver ya de kra na kum omo kese o they die from what you call cardiovascular diseases heart attack and stroke and heart failure no because on says you can metabolic syndrome no a third non-alcoholic fatty liver disease iba no and no also na cause heart attack and no na cause stroke no na cause you say peripheral vascular disease on say wo blood vessels no afi na narrow na moja no ntimi enkokokoko ba bi ye it is all fatty liver disease ya say risk factors no for cardiovascular disease
so
you have it so they die more of the cardiovascular disease than even the liver disease and smoking is a major risk factor when it comes to cardiovascular disease
na age
on say no wunyini no na omu yedu I want say wunyini na especially man no ya wo no na
body neighbor
omu enyini wunyini so diabetes neba na hypertension neba enti omu enyini no omu ewo more fat than omu nyini ya no enti age so like a risk factor for obia obetimi develop fatty liver.
Nyoma waka nyina ma me feel say akwala ntumi nya fatty liver. However no na same trend first na nke say diabetes type 2 kran kan kwala nya je se wanyi edu baby na say no mo say obi na cardiovascular disease started 20 years 19 be 15 years no mo kwakasa nyoma. Is it possible for them to get fatty liver?
If you see once you are obese and now you see most of the children when you see them they are overweight or obese and then that's where the fatty liver starts. Okay, and when you develop it early then it means that the chances of it progressing is high. Okay, so we don't want our children to eat unhealthy food so that they become obese. They develop fatty liver at early age group. Then if like they keep on growing, then the fat in the liver will destroy the liver cells and the liver will not be able to function well. So it affects everybody, whether you are a child, you are adult.
To take home message for us here then.
And to take home message in say fatty liver no does no Ghana. When you probably almost quite scan for maybe other investigation and you who say almost liver no fatty baby we home. The American say the deba no yenim alcohol ana omo diabetes omo sun baby omo nya exercise. Enuane a enye healthy a didi no. These are the things that brings about fatty liver. And when you have fatty liver, it can progress to destroy the liver and you will develop liver failure. And sometimes liver cancer. Okay, and you know liver cancer is the commonest cause of cancer death in this country. Okay, and once we have fatty liver and it can lead to liver cancer, then we all have to make sure that the risk factors in the liver no yebehunu na so what diabetes ya manage diabetes ni ye. So we move do we make sure so by exercise we be ye na we swati ye. So our cholesterol bebre we moja mu a You do better to do so. Now the lifestyle intervention that can home. Said the better cholesterol and the better fem. When we do all these things, even if you have the fatty liver, it will not progress to destroy the liver to a point in time that the liver will not be able to support you to live. Okay, and if the liver is unable to support you to live, then it means that you will take a lead and join our ancestors. Then we will follow you later.
Hey, Miss Renswanya, receive Doctor Das. Amayati say, hey, you know they watch your mouth. And Kola Kranya careful.
And Kranya careful. And they say, I'm a cross as a champion.
Oh, yes. Oh, yes. And Papa. We have learned so much. Now we know. Sradia bebre. And yet, periods. Period. We'll be right back.
So that mom can be able to open the door. This is it.
Listen to the door.
Here's my little brother doing something special. He's setting the camera up with another bright idea.
Let's just open the door.
Yay!
Mom, I got it.
Afedie, usu betumi nya kwenya sronko a ye nije ye power Vodafone so. Ye di data bundles a eni seso Ghana ha bro. Ye ma da ye so, ye ni daso nyina bem. Enti beka ye ho, nya data mo ni je power bebre.
Vodafone, further together.
Jaden is a patient of ours who's been with us for a number of years. He was born with a bit of a complex abnormality, made up basically of, let me say, 3 parts. One is the fact that there was no normal anal opening. So stool was not coming out normally. The other one was that there was no normal urinary open. There was no real normal phallus. And therefore, when the child was born, there was confusion about the sex of the child. And the parents were not sure whether the child was a boy or a girl. So a number of investigations were done and a number of surgeries started. So the initial surgery that was done was to create an opening through which the child could pass through the abdominal wall. And this was done to allow the child to be able to feed and to grow a bit while we did our further investigations. They also have the challenge of a bladder that collects urine, but again without any control. And we need to think of surgery to bring control of urine. Then we have the third factor of the phallus or the penis. Now what's happening is that this child is passing urine from an opening which is not through the penis. And even though we have formed one artificial one for him, he's going to need surgery in order to bring the urine to the tip of this phallus. However, it is known that when the child grows older, he's going to need a definitive surgery to form a phallus that he can use more in adult life. So even though we formed a phallus, the child is going to need another surgery, at least from the age of puberty going, to form an adequate phallus, and then also to bring the urine to the tip of it so that he can urinate like everybody else. So those are the plans we have for the future. In the meantime, he has a phallus and he's leaking urine from the bottom of the perineum and does not have much control of that.
With the timely assistance of Vodafone Healthline, we have secured funds for baby Jaden's surgery, and we wish him all the best.
Hello, once again. Today, in This Week in Medicine, we talk about the first successful penile and scrotum transplant.
not just the penis and the scrotum. Before I tell you about that, I'll give you a historical overview of transplant surgery, where we came from and where we are. In the 16th century, Italian surgeon Gaspero Tagliacozzi, sometimes referred to as the father of plastic surgery, reconstructed noses and ears using skin from the forearms of patients. In 1905, Edward Zerm, an Australian ophthalmologist, performed the world's first corneal transplant. 1912 saw Alexis Carrel receive a Nobel Prize for his work in developing methods for connecting blood vessels and conducting the first kidney transplant in dogs. He went on, together with his friend Charles Lindbergh, to invent a device for keeping organs viable outside the body. In 1954, a team of doctors in Boston, the Peter Burns Brigham Hospital, performed the first successful human kidney transplant between twin brothers. Since then, several advances in transplant surgery has allowed several organs to be transplanted, with more advances in the transplant field ongoing. The first successful penis and scrotum transplant was performed in 2018 by a group of surgeons at the Johns Hopkins Hospital. The patient was a veteran that suffered a blast injury at war in Afghanistan. It took 14 hours to complete. I hear someone asking a question. What about the testes? Were they transplanted? No, they weren't. This is all we have for this week in medicine. And the penyasan can offer surgery what you offer. Ebia nyimpa nankasa no honam fi one side, what about another side? And offer bi no honam ana no body part. What if fi nyimpa kro no what another person? I offer transplant surgery. Chere transplanting was started actually. Doctor says wa kom wa ye wa tra, but nan saying na me na dom. The field of transplant surgery why here more convenient. Many more people want your kidney transplant, lung transplant, heart transplant than Yamiasi. That's all we have for this week in medicine.
Welcome in today's episode of Duos in the Kitchen with me, Ferma. We'll be talking about Esuri Wisa. Yes, we said a form Wisa the other time. This Esuri Wisa basically is the black one. Wisa ne tuntumu. Okay, this is Ghana black pepper. Actually, it's very similar in function to kokono because it also helps with cough. Interestingly, it's antioxidant, it's antimicrobial, and it helps the body become strong. It's actually also used like a food preservative, just like Pintia. Okay, so we want to do that, but it's got no aphrodisiac properties whatsoever. None. Okay, so don't confuse the two. It's the red that has the aphrodisiac properties. This doesn't. This is just basically antioxidant. It is antimicrobial. It helps with gut to boost your immune system, and it's good with cough. So that's basically what the dark one does. What we got the cayenne pepper. It does. I've tried it with the cough thing though. It gave me some sort of relief. And I was really impressed. The kaki kedrong.
I see.
Now I'm brewing like tea because I didn't have something to blend it up. So I brewed it like tea and I sipped it. So I think the warmth, you guys understand the thing about cough more than I do. I wonder the warmth and its own antioxidant properties and whatever it does with cough really did give me a good night's sleep. I would not recommend it for a child because it's hot. It is hot. So I was like, oh man, I wish it wasn't that hot. My babies can enjoy in the hamatan. it was a bit too hot. It won't be good for children. So highlights for me was fatty liver disease. Apart from obviously jewels in the kitchen, fatty liver and learning that non-alcoholic fatty liver disease is linked to nutrition was like great news. Because when you keep telling people, they don't believe you. But when the doctors themselves say it, they realize there's no propaganda that nutritionists have been saying or that teachers have been pushing us to eat well, eat well, eat well. You know, it can affect us in a very, very negative way. So I was happy about that.
I'm just going to encourage us to remember to do the Kegels exercises as often as we can. You know, if you don't want some change that is worrying to that area, especially after delivery, especially multiple delivery. So hold the urine when you're urinating, hold it for a couple of seconds, release. Hold a couple of seconds, release. And that should help to strengthen the pelvic floor. Yeah.
Okay. For me, I think I still want to talk about stigmatization. From This Week in Medicine, we see how a young man could be stigmatized, you know, once again, through no fault of his, you know, for several years. We see how this, I mean, in other episodes, you know, it just keeps coming. And it occurs to me how cruel we can be as people, you know. So let's be more compassionate towards one another.
True.
And for Jaden, I really do pray that the end is glorious.
We pray the same. If you have any more questions or you didn't understand anything at all, you can always call 255. They are qualified medical practitioners, doctors, and all of them are there to answer your questions. It's been a pleasure. I hope you now understand the form visa and the true visa. And you will not mistake the two. Okay? But
Because
so we
of
meet.
aphrodisiac.
Yes, of course. The red means aphrodisiac all the way. The black means cough all the way. That's simple, you know. Nothing strange there. Anaba.
How much should I take if I want to use an aphrodisiac?
It's regular use.
Regular. You said it in the
I'd already said that.
Yes, you did. I was just asking for a friend.
You heard it drop.
Yes.
Okay, no challenge. Once again, it's been lovely. We've learned a lot. We've actually had fun. Okay, we've had fun. And we know that learning doesn't stop here. Don't forget 255 is available to you all the time. Till we meet again next week, it's bye for now.
Bye.
Enjoy your week.
Vodafone, further together.